At one level, I've worked with students a long time. I worked in higher education before I was a psychologist in multiple roles through a campus ministry setting, through residence hall coordinator, a community director in the residence hall, through supervising and advising CAs, we call them here, helping run hall councils. So I've had lots of higher education experience, and through those years of doing those different positions, I really got to know students. And because college had such a profound impact on me, and it was a place where I kind of came into my own in lots of ways, emotionally, relationally, spiritually. And so I found just amazing depth in the students I worked with. And the more I spent time with students and the more counseling I did with students, the more I realized the emotional mental health side of people's lives is profound. I realized it in my own life. I realized that in the students I worked with lives. And so I found the importance of all of us as humans getting in touch with the emotional side of us, and that's where health and healing comes. Because if we're emotionally aware of what's going on, it does help us in all other realms of life, intellectually, academically, relationally, at all levels. So that was my journey to finally say, I think I'm going to go on for this PhD in clinical psychology and gain the skills to really know how to help guide someone to a place of their own emotional health and wellness. The greatest thing I think for any student to do is to not separate them, to accept that the body speaks, but the body speaking may be about an emotional issue. The emotions speak, and we may not take care of the body because of that. So it's not an either or, it's a both and. So the both and is, if I have a stomach ache and I realize it's a stressful day, my body's speaking. So I can speak generically to that, absolutely. Or I can just speak to it in the sense of being able to be available to meet needs and to assess quickly, especially in a university setting, what the needs are, what we are able to do at this level of care in a student counseling center versus private practice versus an inpatient treatment center versus a hospital setting. And so I think always assessing, and I appreciate the work that we do in the sense of that question is never done. We're always saying, how do we assess to make sure we're meeting student needs? So there's always creativity, always a chance to find new ways. A couple is my own personal spiritual time. I ride the shuttle bus, so I have some reading that I do and some different things. We do a lot of mindfulness, so a lot of good deep breathing, just calming, even we call it like a vacation in your mind. Take a moment of just doing some deep breathing, learning to hold your breath in like even accounting. It sounds so weird, but 5, 7, 9 breathing. So you breathe in your nose, hold it for 7, breathe out your mouth. But it's amazing how we hyperventilate throughout the day. So at a wellness level, not just an emotional, spiritual level, but at a health level, people's blood pressure rise. They're more anxious. There's a chance for more panic when we're going like that all day.
Yeah.
So for moments where I can catch that I'm like moving nonstop, throughout the day, then after my morning time of just downtime and reading, I try to do some meditation, prayer meditation. Those things are kind of constant for me, and music can be also very calming and soothing.